Are you currently suffering with shoulder pain and it has been told it's coming from your rotator cuff muscles? If that's you, keep watching. Hi, my name is Dr. Wong with Next Level Physiotherapy, and today I'm going to share with you the best 5 stretches that I give my patients with shoulder pain from rotator cuff issues. Before we get into the stretches, I have to talk about the 4 rotator cuff muscles of the shoulder. You have one muscle in the front called subscapularis. The job of that muscle is to turn that arm in. You have 3 muscles in the back of the shoulder blade. That's called your supraspinatus, infraspinatus, and your teres minor. They're responsible for turning the arm out or having your palm face up. Most of the patients that come see us for shoulder pain typically have a rounded posture with an arm that's internally rotated. So that means the subscapularis muscles in the front are tight. So the first thing we're going to do is loosen up that muscle to help regain some motion. In order to do the subscapular stretch, all you need is a cane or stick. The way you do it, I'm going to stretch my right arm. If you take the cane, you can hold it and have the stick or cane behind that right arm. Have it around the midway point, and then from here, with your opposite hand, you're gonna pull the bottom forward. So as you pull the stick forward, your hand will tip backwards. You should feel a nice stretch in the shoulder. You should not feel any pain. If you do, you're pulling way too hard. Hold this for 20 seconds for 3 rounds. The next exercise is pendulums. This is a great exercise to provide some traction to that shoulder to give it some relief. And this is how you do it. Let's just say my right shoulder is the one that hurts. You take your left arm, prop it on a stable surface. You get into a lunge position. So left leg in the front is bent, back leg, the right leg is straight, open over shoulder width apart. And then from here, put 15 seconds on the clock. You're gonna shift your weight forward and back. Arm is relaxed. You feel a nice stretch in that right shoulder. Once 15 seconds are over, you go left and right, same thing. You can also do clockwise and counterclockwise as well. Whichever position or motion you do, 15 seconds on the clock and work up to a minute. The next exercise is a shoulder flexion with a cane. Let's say my right arm is the one that hurts. Put my right hand on the hand of a cane, use my good hand, my left arm, to raise up that arm. Try to keep that painful arm as relaxed as possible. Most of the motion should be coming from the good side. There should be no pain with this. If there's pain, you're probably going way too high or you're going too aggressive. You want to do this for 20 times. Now, if you work a desk job and you don't have access to a cane or stick, this is another way you can do the same motion. Let's say for our purposes, right arm still bothers you. Take that right arm, prop it on a stable surface, and then you're going to scoot backwards. For a nice stretch, should be no pain with this. You're going to go back and forth. You want to do this for 20 times. Once again, no pain, otherwise you're going too far or too aggressive. The next stretch is called shoulder abduction, or what I call the wave stretch, because the motion is like you're waving at someone. The way you do this, you have a stick or cane, you hold with a painful arm. With the good side, the left arm here, you're going to push up and bring it down. Try to keep your right hand and arm as relaxed as possible. Most of the work is done from the good side. 20 times. Make sure as you're doing this, there should be no pain, otherwise you're pushing way too hard or way too high up. If you don't have a stick, an alternative way is to prop your forearm on the doorway, get into a lunge position, so left arm on the doorway, right leg on the outside. And then what you can do is you're not going to lean forward, you're going to drop your chest about a 45-degree angle, like my hand. As you do that, you should feel a stretch in this area right here. Hold for 10 seconds for 6 rounds. If you want to take it to the next level, prop one hand on the door or wall. You're going to sidestep and lean into it until you feel a nice stretch on the shoulder. Hold this for 15 seconds for 4 rounds. Should be no pain, otherwise you're leaning too far in or you're stepping way too far out. Repeat on both sides. The next stretch we're going to talk about is a sleeper stretch. I'm stretching my left arm. The way you do this, you're on your side, you're in a 90-90 position. So straight arm this way, straight arm up, relax your neck. And what you can do is you can take the top arm and press that wrist down towards the floor. You should feel a nice stretch in that shoulder. This shouldn't cause pain. And then relax. You press down, hold for a 10 count, relax. 6 rounds of 10 seconds. Now that you know the 5 best stretches that I give my patients for rotator cuff pain, let me know which of these exercises work best for you. If you found this video helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you next time.